impoverished minorities, particularly children. Next. And then sa perpetuating risk factor naman is immigration from countries with a high prevalence of tuberculosis such as Southeastern Asia, Africa, Latin America, and Caribbean. And then and then another factor is institutionalization, such as long-term care facilities, psychiatric institution, and prisons. Kasi sabi daw yung itong bacilli na to is kaya niyang mabuhay sa sa facilities ng over 3 months o abot ng 6 months. Depende kung kung hindi siya natatamaan ng direct sunlight. And then living in overcrowded substandard housing, and then being a healthcare worker performing high-risk activities. Syempre, tayong mga health workers mas exposed sa mga may sakit. So mas risk tayo sa gantong sakit. The administration of aerosolized pentamidine and other medications, sputum indication procedures, bronchoscopy, suctioning, coughing procedures, caring for immunosuppressed patient, home care with a high-risk population, and administering anesthesia and related procedures such as intubation and suctioning. So yung mga procedure na mas risky yung mga healthcare worker kapag ginagawa tong mga procedure na to. And then next. So sa signs and symptoms naman is fever, cough, night sweats. Pag sinabing night sweat, ito yung yung gigising ka na tumatagaktak sa pawis. And then fatigue, weight loss, hemoptysis, or yung ubo na may kasamang dugo na nanggagaling sa lungs. And then bronchopneumonia, which is a type of pneumonia na nagkakaroon ng inflammation sa alveoli, which kinoconstrict niya yung airways, kaya nagkakaroon ng trouble breathing. Next. So sa diagnostics naman, so tuberculin skin test or Mantoux test. So itong tuberculin skin test or Mantoux test, they'll inject a tiny amount of fluid below the skin in your forearm that contains some inactive TB protein. So positive siya if you have a raised or hard bump and swelling sa arm mo. Kasi it means marong TB germs sa yung body pag nagkaroon ng raised tsaka hard bump sa arm. And then quantiferon TB gold test. Yung quantiferon TB gold test naman is tawag nito alternative test for Mantoux test. And then sputum culture, which is test siya na to find TB bacteria that cause infection. A sample of sputum such as phlegm is added to a substance that promotes the growth of bacteria. And then yan, next. So sa medical management naman, so medications, meron tayong tinatawag na first-line anti-tuberculosis medications, which is isoniazid, rifampin, rifabutin, rifapentine, pyrazinamide, and etambutol. And then combination medicines naman, isoniazid plus rifampin or isoniazid plus pyrazinamide and rifampin. And then meron naman tayong tinatawag na second-line medication in which itong second-line drugs na to, they are used when first-line drugs show no effect for disease or kapag nagkaroon ng resistance yung disease sa first-line medication. Ito yung mga caprimycin, ethionamide, para-aminosalicylate, sodium, and cyclochloricin. And then additional potentially effective medications then, aminoglycosides, quinolones, rifabutin, and clofazimine. And then sa treatment naman, initial phase consists of multiple medications regimen of isoniazid, rifampin, pyrazinamide, and etambutol plus vitamin B6 50 mg, and then continuation phase for an additional 4 to 7 months. So yung initial phase pala, umaabot siya ng 3 months, and then sa continuation phase naman, 4 to 7 months. Kaya 'di ba, yung tuberculosis, siya, long-term treatment siya, umaabot siya ng 6 to 9 months, 'di ba? And then DOT, or directly observed therapy, which is most cost-effective way to stop the spread of tuberculosis. Standardized treatment regimen directly of 6 to 9 months observed by a healthcare worker. Ayun, and then INH therapy, or isoniazid therapy. Next. So nursing management, assessment, signs and symptoms, physical examination, personal health history, family health history, and exposure with someone who has active, and then diagnosis, ineffective airway clearance, risk for impaired gas exchange, risk for infection, activity intolerance, imbalanced nutrition, less than body requirement, and deficient knowledge. So sa planning naman, promoting airway clearance, promoting adherence to treatment regimen, promoting activity and adequate nutrition, and then preventing transmission of tuberculosis infection. And then sa intervention naman, instruct the patient about correct positioning to facilitate drainage and increase fluid intake to promote systemic hydration. And then teach the patient that tuberculosis is a communicable disease, and taking medications is most effective means of preventing transmission. And then plan a progressive activity schedule that focuses on increasing activity tolerance and muscle strength, and a nutritional plan that allows for small or frequent meals. And then carefully instructs the patients about important hygienic measures, including mouth care, covering the mouth and nose when coughing and sneezing, proper disposal of tissues, and hand washing, and be alert for adverse effects of medications. So sa evaluation naman, airway clearance of a patient is improved as evidenced by noiseless respirations. And then patient maintained optimal gas exchange as evidenced by oxygen saturation of 99%. And then patient consented for TB treatment. Patient remained normothermic as evidenced by temperature of 37 degrees Celsius. And then patient understands the importance of good personal hygiene. So, pathophysiology na po tayo. So, ito try ko pong i-explain sa inyo yung pathophysiology ng tuberculosis kasi medyo mahaba siya. So, ayun. So, di ba yung tuberculosis can be transmitted through droplets. So, if a susceptible person inhales infective droplet of mycobacteria, it will be transmitted through airways, and then mapupunta siya sa bronchioles and alveoli, in which magkakaroon ng deposition and multiplication in the apices of lungs. And then it will be transported via lymph system and bloodstream and to the other parts of the bodies, which is kidneys, bones, cerebral cortex, and other areas of the lungs. And then kapag kumalat na sa other areas of the body yung yung bacteria, magkakaroon ng inflammatory reaction and then phagocytosis, in which yung TB-specific lymphocytes will destroy the bacilli and normal tayo na yun. Wait lang. And then granulomas will be surrounded by macrophage. Next na ba? And then mag-form ng protective wall, in which magta-transform into a fibrous tissue mass. Okay. Guys, wait lang. I'm not feeling well. Pwede ba next na muna? Ulitin ko na lang. Hindi ko masyadong hindi ko masyadong naaral to. Sorry.
Hello, good afternoon. So for the next topic po is we have the bronchiectasis. Wait lang, be, makikiulit nga. Maingay eh. Okay po, ito na. So we have the bronchiectasis po. Diba sa title is matatandaan na natin yung disease. So parang ito na rin yung pinakang matatandaan natin. So bronchi and ectasis, yun po yung two root words po natin dyan. So yung bronchi po, di ba po may mga subdivisions po siya? The main or the primary, the secondary or the lobar, and then the segmental or kaya naman po is the tertiary. And then we have also the bronchioles and the terminal bronchioles, the one that adjacent to the alveoli. So any of them po may suffer from ectasis. What is ectasis? It means po dilation. Ibig sabihin, any of them po, yung mga subdivision po ng bronchi is lumalaki. So, nagdadilate po yung bronchi. Mabilis ba? So, basta yung, mabilis ba yung salita? Sorry. sige. Slower. Okay. Po, yung bronchiectasis po. Yung bronchi po kasi dyan, hindi lang, marami po bifurcates into two branches po, which is po, yun po yung primary bronchi. Tapos, yung mga sumunod na mga subdivision or yung lobe is the, ang tawag doon? The lobar, the segmental, and then the bronchioles, and then the terminal bronchioles, o yun po yung terminal bronchioles, yun po yung connected po, ang kasunod po nun is the air sacs o connected po sa air sacs. So, any of them po may suffer from this ectasis. Ibig sabihin, magdadilate, lalaki sila. So, di ba yung normal, kapag nagkakaroon ng inflammation, ang nangyayari sa bronchi is nagko-constrict. This time naman po, nalaki siya, okay? So, yun po yung bronchiectasis, the dilation of bronchi. Tapos next po, next po. Doon na sa, pinakang definition. So, the definition, it is a natunog. So, it is a chronic, irreversible dilation of the bronchi and bronchioles due to or associated with chronic infection that causes destruction of the airway walls. So, sabi dyan, chronic, irreversible. Meaning po, pag nagkaroon na ng dilation o lumaki po yung bronchi, permanent na po yun, hindi na po yun mababago. Hindi na siya mababalik, lifetime na to. Tapos, sabi dyan, it is associated with chronic infection. So, ibig sabihin, slow progressive disease. 'Di ba? Kapag nagkakaroon ng infection, may inflammation. That's why mababasa tayo, parang yung causative agent niya is chronic infection, chronic inflammation, kasi yung infection, kasunod naman nun is inflammation. And by that, nagkakaroon ng destruction of the airway walls. So, ang sinasabi sa bronchiectasis, nagkakaroon ng structural changes dun sa may bronchi, nalaki, and then, dito, and then, nagkakaroon din kasi ng massive hypersecretion of the mucus. Mamaya mame-mention ko naman siya. Kaya nakalagay dyan, severe or repeated respiratory infection. So, paulit-ulit lang yung infections until na mag-develop yung bronchiectasis. Okay? So, next po. So, it was originated daw po from Paris, France, and the causative agents are Streptococcus pneumoniae and the Pseudomonas aeruginosa. Okay, mabilis pa rin. So, yun. The causative, wait lang po. Yung sa may, Streptococcus pneumoniae and Pseudomonas aeruginosa, yan, dito. Yung parang pinagkapares ng dalawang yan, di ba may mga, kapag nagkaroon ng infection, may nirelease na chemical mediators, mas nagda-dominant na chemical mediators is the neutrophils. So, parang siya yung pinaka-responsible in developing this bronchiectasis po. So, next po. Yan. So, for the, risk factors, or predisposing factors po. Yung mga predisposed po dito is yung may mga recurrent respiratory infections, simula nung bata pa lang sila, such as the pneumonia, yung tuberculosis na diniscuss po ni Nicole kanina, and then the measles, and then the whooping cough. And then kapag merong airway obstruction, diffuse airway injury, may pulmonary infection and obstruction of the bronchus, or complication of, of long-term, pulmonary infections. And then, meron din pong abnormal host defense. So, ito parang genetics na siya, the ciliary dyskinesia and humoral immunodeficiency. So, yung yung ciliary dyskinesia, ibig sabihin, paralyzed na yung cilia. Hindi na nagagawa ni cilia yung function niya. Impaired na siya. And yung cilia, yun yung parang buhok. Diba? Tiny hair-like dun sa may, nakaline in the epithelial cells. Sila yung responsible for trapping the dust, for moving the phlegm or the sputum para ma-expel. Okay, and then the genetic disorders pa is the cystic fibrosis. So ito tatandaan natin, kapag may cystic fibrosis po at may bronchiectasis, mas nagiging malala pa yung condition kasi nagiging sticky yung mucus. So mas nahihirapan lalong ilabas. Okay, so next po, precipitating factors naman. Wait lang, ba't iba yan? Okay. Wait. Okay. Precipitating genetic disorders, just like hindi. Yung nakalagay kasi dito sa copy ko, smoking and unhealthy lifestyle. So, sige, consider natin ang precipitating cystic fibrosis and idiopathic causes. Or let's also include the smoking. Kasi yung smoking, dito. Kasi precipitating, diba sa mga lifestyle to? So, kung dito, sa precipitating, yung smoking kasi, ang ginagawa niya sa cilia is pinaparalyze niya din. So, ini-impaired na agad yung cilia. And then perpetuating. So, let's say na lang na yung mga passive smoker or yung second-hand smoker. Ibig sabihin, kahit hindi po sila naninigarilyo, pero yung mga nasa paligid nila is nag-i-smoke. So, yun, affected din sila or risk din sila for developing this bronchiectasis. So, next. Okay, for the signs and symptoms, we have the productive cough. Ibig sabihin na ilalabas o na-expel po yung sputum. And then nakalagay dyan, purulent sputum. Ibig sabihin, tinitingnan natin yung color ng sputum. White ba? Greenish? Yellowish? So, that may indicate bacterial infection. So, ang hindi po kasi na-include dyan, yung parang pinakang unique characteristic yung parang unique signs ng bronchiectasis is the copious amount of sputum. Pag sinabi kasi natin copious, marami siya. So, yung pagda-diagnose kasi ng bronchiectasis is medyo mahirap. Kasi yung signs and symptoms niya, para mapagkakamalan natin na signs and symptoms po ng bronchitis. So, yung tatandaan po natin dito sa may purulent sputum that may indicate the severity of the disease, yung amount po, for example, in 24 hours po, less than 10 ml ng phlegm or sputum is that indicates mild bronchiectasis. So yung less than 10 ml sa sa loob ng 24 hours. Yung less than 10 ml or kaya naman is less than 150 ml, that indicates moderate bronchiectasis. And then yung greater than 150 ml, that indicates severe bronchiectasis. So baka maitanong nyo, so paano yun? Ba't nagkaroon ng 150 ml? So yun yung sinasabi ko na parang unique characteristic ng bronchiectasis na marami kang nilalabas na sputum, hindi yung agad na kunyari, umubo ka kaagad, sobrang dami na. So frequent yung paglabas frequent kang naglalabas ng sputum in just 24 hours po. So yun yung copious. No? And then, hypoxemia. So, hypoxemia, ibig sabihin, decrease yung oxygen in the blood. Ibig sabihin po na, kasi ito sa bronchiectasis, just like yung pathophysiology din ng COPD, nagkakaroon din po ng massive secretion of the mucus, tapos bronchoconstriction din sa una, kasi nga, hindi agad naman matik na kapag na kapag may infection, magdadilate agad yung bronchiectasis. Yung parang naging normal response is bronchoconstriction muna until na mag-develop na ng until nga na mag-dilate yung bronchi. So dahil nga nagkakaroon ng, o kaya kahit dilated na yan, tapos yung airways is flooded with mucus, so nagkakaroon ng mucus plug. So nagkakaroon ng airway obstruction. So kapag may airway obstruction, ibig sabihin may airflow limitation. It means po na yung nai-inhale ng air na, kasi when you try to inhale, may force. So, pero kahit may force, limited pa rin yung air na pumapasok o yung nakakarating sa alveoli kasi doon nagkakaroon ng gas exchange. So, nagkakaroon pa rin ng decrease in oxygen. Kaya nagkakaroon ng hypoxemia. At yung hypercapnia naman, it is because hindi natin mailabas yung air kasi when you try to exhale, normal lang, parang walang effort, parang ang hirap ipuwersa. So, kaya yun, and because of the obstruction or the mucus plug presence inside the airways po, yun, hindi na ilalabas yung carbon dioxide. Kaya increase yung residual volume. Then next is dyspnea. It is because of the airway obstruction. And then hemoptysis na mention to ni Nicole kanina na yung blood o yung sputum na merong blood. So yun. Indicator din to ng severity of the bronchiectasis. The more na marami kang nilalabas, the more na maraming dugo o presence ng dugo dun sa may sputum, means severe yung disease. Then, clubbing of fingers and nails din. Included din yung nails. Kasi, ang clubbing of fingers, kapag isi-search nyo, kung titingin tayo sa may buto ng finger, para makapal siya o lumalaki. Kasi nag-undergo kasi because of the hypoxemia. So, di ba, systemic circulation, alimbawa, decrease yung oxygen, yung oxygenated blood from the lungs, then pumunta sa left side of the heart, tapos pinump, to systemic, di ba? To systemic. Hindi lahat ng blood, hindi lahat ng tawag dito, inadequate yung blood, yung oxygenated blood na nadidistribute sa cells. So, that's why, nagkakaroon po ng clubbing of fingers. Yung first is yung nails muna. Sa nails muna, kapag nakita nyo is parang siyang nakaangat, yung parang matatanggal na. Tapos yun namang sa may buto ng fingers is nag-undergo po ng periostosis. Ibig sabihin, yung bone mo dito sa may finger is nagpo-produce pa siya ng another bone. So parang kumakapal nga. Yun yung nabasa ko sa research. And then, cyanosis because of the hypoxemia, and then the abnormal breath cells because of the presence of the mucus inside the airways that create sounds, which is the crackles and rills, and then based din sa ibang reference, may wheezing din. So next po. Yan. So for the diagnostics po, we have the chest CT scan. So this chest CT scan po provide definite diagnosis for bronchiectasis. Kasi nakikita yung structure po dito nung lungs kung nagkaroon na po ba ng changes. So yon. And then sa sputum sample naman, it is very useful kasi dito natin kinukulture yung sputum para malaman natin kung ano yung microorganism na presence doon sa my sputum. For example, yung Pseudomonas aeruginosa ba? O yung Streptococcus pneumoniae. So yun, para kaya natin ginagawa to is para alam natin kung anong antimicrobial therapy yung ibibigay ng doc. Then blood test, CBC. So ang titingnan natin doon is that di ba sabi ko kanina recurrent infection, chronic infection. So kasi the more na maraming mucus, nag-a-attract yun ng maraming bacteria. So meaning, kapag dito sa blood test, pwede natin ma-identify kung ba yun, viral ba yun o bacterial, tapos mataas ba yung neutrophils at segmenters. Kasi when yung segmenters o neutrophils mataas, it indicates na bacterial infection. Lymphocytes naman, viral. And then for the lung function test naman po, this include the incentive spirometry. So yung incentive spirometry, siguro nabasa niyo naman yung yung sinend ni sir. So yung sa incentive spirometry po, nilalagay yun sa mouth, hinihihipan. Kasi this incentive spirometry po, it measures how much air you can breathe out. So, ibig sabihin, exhalation, minimeasure carbon dioxide. So, the more na mababa yung percentage, or let's just say, the forced expiratory volume in one forced breath or in 1 second, it means na severe yung condition. Kasi, hypercapnic yung ibig sabihin, maraming ibig sabihin nun, di mo na i-exhale lahat ng air na dapat i-exhale. So, hypercapnia. Ganun, parang sinusuportahan nun. And para ma-diagnose din if may cystic fibrosis. So, kapag may cystic fibrosis, yung mucus is nagiging Next. Baka nawala na ako. Ano kasi? Ayun pala. Yan. So, yan. Medications na tayo. So, medications, we have the oral antibiotics. So, oral antibiotics, antibiotics for bacteria, di ba? So, we have the amoxicillin. So, yung amoxicillin, yung function niya is, ini-stop niya yung bacterial growth, tapos amoxiclav, tapos flucloxacillin naman, ini-inhibit niya naman yung bacterial wall synthesis. Rifampicin is ini-inhibit niya yung bacterial DNA-dependent RNA synthesis. And then the ciprofloxacin naman, which is under siya ng fluoroquinolones, and target niya yung mga gram-positive and negative bacteria. And yung pinaka-mechanism nito is ini-inhibit naman yung cell division para hindi na mag-multiply yung bacteria. So, next is intravenous antibiotics. We have the benzyl penicillin, cefuroxime, which is ini-inhibit din po yung bacterial growth. Then, search na lang yung iba, hindi ko na sinearch yung iba eh. Then, ceftriaxone, vancomycin, ceftazidime, and then we have this yun, cefuroxime. For the bronchodilators naman, so baka magtaka ulit kayo, bronchiectasis, tapos may bronchodilators pa, idadilate pa ulit. Sabi ko nga po kanina, it is bronchiectasis is a slow progressive disease, means po, nadaan din po siya sa normal process pa na, nagkakaroon ng bronchoconstriction. That's why I think, ina-administer din tong bronchodilators. There's the albuterol, levobuterol, long-acting bronchodilators such as formoterol, tiotropium, and salmeterol. So for the expectorants, para mailabas yung yung mucus and mucus thickening medicines po, we have the hypertonic saline and inhaled mannitol. Next po. Next is we have the treatment. So, hydration. So, para to aid the mobilization of the secretions para mailabas. And surgery. So, ganito po kasi sa bronchiectasis, kung ano lang po yung nag-dilate, yun lang po yung affected na, ang pwede nating i-remove. So, kaya may tinatawag po tayong, pneumonectomy, tapos lobectomy, kung yung nag-dilate ba is a part ng lobar bronchi, or kaya naman segmental resection, yun naman yung i-remove, yung segmental lobe or yung bronchi. So yun, kung ano yung affected, yun yung tatanggalin para ma-preserve din yung iba. Kasi sige, wag na nga. Tapos shortcut ko dun sa chest physiotherapy kasi under ng chest physiotherapy is the postural drainage, bronchial drainage. So, discuss ko na sa postural drainage. Yung postural drainage is that, yung rationale nito is to mobilize the secretions. Ibig sabihin, si patient, if not contraindicated, kapag humiga, kunyari, ipuput natin si patient in supine position. And then, maglalagay tayo ng pillow doon sa may hips or naman doon sa may buttocks para yung level ng chest is lower than the lower extremities. So, parang minumove natin yung mucus, yung pababa, yung kunyari, magagaling sa may kunyari yung mucus is nandun sa may part ng bronchial, so mamove siya. Halimbawa, mamove to segmental, ganun. Parang ini-aid lang natin yung movement. Tapos next is, we have to promote then also the smoking cessation kasi this will continuously paralyze the cilia, and then parang it also contribute to exacerbation. So ibig sabihin ng exacerbation, yung nag-worsen yung disease. And then antimicrobial therapy, nakadepend po to sa my sputum sample. Kung should naman si regional cell, yun, ganun. Tapos next po, okay, for the assessment, Be, makikibalik nga po dun sa assessment. Yan, sige, Be. So, for the assessment po, syempre, evaluate natin yung signs and symptoms na na-mention kanina. Just like yung increased sputum production. So, titingnan natin yung sa sputum, yung color. Tapos, kung may fever ba si patient, ganun. Tapos, dyspnea, ganun. So, for the assessment, we have also to evaluate the current smoking status of the patient, and then evaluate the exposure to occupational toxins or pollutants in indoor or outdoor pollution. Baka kasi yun yung nagko-contribute o yun yung naging parang cause kung bakit nagkaroon Oh, Bev, makikisunod. Yan. So, diagnosis. Ano, wala ko? Sorry, wait lang. Okay. May ririnig na ako, Myri. Okay, Beth. Thank you. So, yan, diagnosis. First is we have the impaired gas exchange. Kasi, with impaired gas exchange, katulad nga kanina may abstraction. Tapos, yung problema kasi doon, alimbawa, sa terminal bronchioles yung nagkaroon ng dilation. So, parang it is for the mucus o yung secretion na kasi magkaroon ng tubig o ganun, o pumunta nga doon. And then, parang connected din kasi itong bronchiectasis o parang complication na din siya ng COPD o connected din po siya sa may emphysema. So, may discuss ko naman yun sa may pato. And then, ineffective airway clearance. Then, ineffective breathing pattern. And then, activity intolerance as the result of dyspnea po. Then, next po. Yan. So, sa planning is, yung goal natin is to improve the gas exchange through administering siguro ng mga medicines, and then non-pharmacologic interventions, ganun. And then achievement of airway clearance by maintaining airway patency, and then improvement in breathing pattern, and improvement in activity tolerance, and yung self-care deficits diagnosis po ata yun. So, next po. Okay, for the intervention, so first is we have to, para ma-encourage si patient na mag-stop to smoke is i-discuss natin this is process na maiintindihan pati ano yung mga factors na dapat ano yung mga contributing factors that will lead in developing bronchiectasis. So yun. And then instruct the patient to do their pragmatic breathing and effective coughing. So the pragmatic breathing, it is very important. So and effective siya. So how to do this? First is when you inhale, dapat inhale 3 times ka magi-inhale dito. Bali, when you inhale, dapat malalim. Yung parang mahaba, tapos exhale ulit, yon, parang mabagal lang, ganun. Tapos at your third time of inhaling, yung you have to hold your breath. Yung parang, di ba, mag-i-inhale ka, tapos i-hold mo yon for 1 to 5 seconds, gano'n. Ay, 3 to 5 seconds. O dapat 5 seconds ata yun. Tapos after mong ma-hold yun, di ba, nakapag-count ka ng 5 seconds, bigla kang umubo. So, makakatulong yun in expelling the sputum po. And then the other one is the pursed lip breathing. I'm not sure, pero I think it is effective na din kasi parang tinry ko din siya na halimbawa, using your lips para mag-form ka ng O. Tapos, hihigop ka. Parang hihigop ka nung, hihigupin mo yung hangin papasok. So, parang, yung mouth mo, parang yun yung nose mo. Parang yun yung ginagamit mo for inhaling and exhalation. So, higop ka ng hangin, tapos ilalabas mo din. Tapos, pagkahigop ng hangin, try mong ilabas din. So, parang, dito? Basta ilalabas. So, kung magagawa niyo yun, parang may effort when you, labas yung hangin. Mailabas yung hangin through pursed lips breathing. And I think parang makakatulong din siya siguro sa ng carbon dioxide removal. I'm not sure, pero I think opinion ko lang ganun. And the next is, we have to instruct the patient to avoid bronchial irritants kasi this will lead to exacerbation. Kasi ito yung mga stimulants natin eh. Ito yung mga parang stimulate para magkaroon na naman ng inflammation, ganun, may irritate naman yung bronchi ng patient. And then, if indicated, perform postural drainage. And then, ano pa ba yan? Encourage alternating activity with rest periods. Next po. Next po. Wala ba ulit ako? Wait. Myri? Ayan, for the intervention pa pala ulit na kasunod. So for the intervention, sinabi ko naman yan, i-integrate naman natin the diaphragmatic breathing while walking or bending. So halimbawa, pag may kukunin si patient na, halimbawa, nahulog yung button, ganun. Pag naman when walking, para makatulong. And then, teach a postural drainage if appropriate. Next po. Yan, so for the evaluation naman, we had to monitor the heart rate. Ay, hindi pala. Evaluation, ma-maintain natin yung heart rate within normal limits, absence of dysrhythmias, and normal mentation. Tapos, yung possible evaluation pa is improve expiratory flow rate, so by using incentive spirometry, and then patient is free of infection. So, paano natin malalaman? No fever, no change in sputum, lessening of dyspnea. Kasi the changes in the sputum, pati nagkakaroon ng fever, meaning po exacerbation. So, patient coughing is minimized, and then patient verbalize the pollens, fumes, gases, dust, and extremes of temperature and humidity are irritants to be avoided. So, meaning parang na-address natin yung deficient knowledge. So, nagkaroon na idea ng knowledge sa patient about the bronchiectasis, and then show signs of decreased respiratory effort and faces activity. So through verbalizing siguro na hindi nahihirapang huminga si patient while doing activities, and then perform activities with less shortness of breath, and then walk and gradually increases walking time and distance to improve physical condition, and then patient does not smoke, and paces activities of daily living to alternate with rest periods to reduce fatigue and dyspnea. Sige, pathophysiology na po tayo. Okay yan. So, parang dinagdagan ko na lang yung ginawa ni Guillermo. Para medyo maano. So, first is, yung bronchiectasis kasi, just na nilagay ko sa, causative agent, di ko na dyan nilagay. So, pwedeng mag-refer na lang kayo dun sa PPT. Pero this also include pala the pulmonary, gusto ko lang i-add yung, di ba, CF, yung may COPD, parang complications din ito. And then, yung may mga, pulmonary embolism can be kasi kapag, formation ng blood clot will stimulate the pulmonary constriction kasi na-expose nga po. Kasi nagkakaroon ng limited oxygen. Basta chronic infection or recurrent infection. Di ba sabi ko kanina, this infection stimulate the inflammatory response. So, kapag nag-stimulate po ng inflammatory response yun, nagkakaroon po ng vasodilation, ibig sabihin, lumalaki po yung blood vessel. At kapag lumaki po yung blood vessel, ibig sabihin, magkakaroon ng increased blood flow. So, ibig sabihin, makakadal ng ice ng dugo. And that is, that is good for the chemical mediators kasi mas madali yung pagpunta nila doon sa area o site ng infection. So let's start na. So ito, the chronic infection or the recurrent infection will irritate the bronchial walls. And what happens next is it induces inflammation. So magkakaroon ng release of chemical mediators. Actually, marami sila pero ginawa ko na lang 3. So parang kasi magpo-focus ako dito sa neutrophils. So, let's just say yung macrophage, ang main function is to engulf the organism, yan. And then, lymphocytes din, parang pinopromote po nito yung production po ng cytokines. And then, the cytokines also produce the neutrophils. Pero ito, neutrophils po, ito yung, dito tayo mag-focus. So, sa neutrophils po, nagpo-produce po siya ng matrix metalloproteinase plus macrophages. Tapos, nagpo-produce din po siya ng neutrophil elastase. Yun yung nasa right side, yung neutrophil elastase. So, yung si neutrophil elastase, magre-release siya ng cytokines, which are the interleukin-1B, interleukin-8, and the tumor necrosis factor, alpha, and the leukotrienes. So, these cytokines, in combination with matrix metalloproteinase, as well as macrophages, do its action. So, first is, nagkakaroon ng bronchoconstriction. So, parang ito yung, nangyayari doon sa, sa chronic bronchitis or kaya sa may COPD. So, nagkakaroon mo ng chronic, bronchoconstriction. And yung bronchoconstriction it means na, nag-enlarge po yung smooth muscle sa bronchi. So, pag nag-enlarge yun, ang mangyayari dun sa airway, just imagine may parang tube or kaya hose na, halimbawa, kumapal. May kumapal dun sa loob. So, ang nangyayari is, nagiging narrowed yung airway. Ibig sabihin, lumiliit yung daluyan ng hangin. So, next is, submucosal glands hyperplasia and the goblet hyperplasia or the proliferation of this. This submucosal glands, kapag nag-enlarge or hyperplasia nga, ganito na lang. Yung submucosal gland and goblet po, they are responsible for secreting mucus. So, kapag pinag-combine sila ng dalawa, para sila nagkakaroon ng mucus production, there will be an increase or massive sputum production. And that will stimulate the coughing reflex, kaya nagkakaroon ng productive cough. And then purulent sputum. So, may kulay, depende sa infection. And then, pero hindi ko na into dito yung copious amount, basta marami siyang nailalabas, ganun. And then, this increase in mucus production will impair the ciliary clearance. So, ito yung parang tiny hair-like na nasabi ko kanina, na minumove yung mucus. Kasi just imagine, nagkaroon ng hindi, ganito muna. Mamaya ko na sabihin yan. So, ineffective ciliary clearance. So, yun yung mga hair-like dun sa may epithelial cells that moves the, the mucus. And then, because dahil impaired po sa cilia, nagkakaroon po ng mucus build-up. So, dalawa po nangyayari. So, in combination with bronchoconstriction, yung nasa taas kanina, and then with the mucus build-up, nangyayari kasi, di ba, nag-enlarge, nag-narrowed yung airways, tapos, it is flooded pa with mucus. So, ano nangyari? Magre-result siya sa airway obstruction. Makikibaba nga po. Myri, makikibaba nga po. So, yun. Ay, wait lang. Ay, hindi pa pala. Isang lang pala yan. PPD. Balik pala. Sorry. Kala ko naka-PDF. So, yan. Diba, kita nyo naman yung sa airway obstruction. Ibig sabihin may bara because of the mucus. So, nagkakaroon ng dyspnea. Nahirapang huminga. Kasi because of the mucus, nagkakaroon ng crackles or rales, tas wheezing, and this airway obstruction po will result to airflow limitation. So, dyan muna tayo mag-stop. So, next is, the mucus build-up po, it will attract more bacteria. So, dahil meron na naman bacteria, so nagkakaroon na naman ng continuous or may stimulate na naman yung production ng chemical mediators. So, kapag paulit-ulit siya nangyari, nag-last for 5 months or more, tapos nag-worsen yung disease, kasi yun yung chronic infection na this will destroy the lung extracellular matrix, o parang ito yung pinaka-supporting structure po ng bronchi o ng bronchi po natin. So just like the collagen, elastin, glycosaminoglycans, and the proteoglycans. So lahat po yan masisira. So pag nasira na yan, kasi kung masasearch nyo, yung nangyari dun sa smooth muscle na nag-enlarge dati na nagkakaroon ng constriction, during the constriction is parang naglulus na siya, parang numinipes, ganon. So kaya nagkakaroon ng dilation of the bronchial walls as a result of the degradation of extracellular matrix. Ibig sabihin lumuluwag na siya. Lumalaki na pala, lumalaki. So, the dilation of the bronchial walls, ito hindi ako masyadong sure dito. Siguro itama na lang mga nakakaalam or ni sir kapag naano niya. So, yung dilation na po ng bronchial walls, yung corresponding yung mga pulmonary arteries na nagsusupply daw po sa may bronchi, dito, pwede daw po mag-rupture o ma-destroy. So, mag-leak doon yung blood. So, sasama din sa sputum, kaya ka pa na-expel, hemoptysis, merong blood dun sa may sputum. Okay? Tapos, pababa po. Next na, be. Mamaya natin balikan yung neutrophil, So, next is, because nga nagkaroon ng dilation of bronchial walls, ito yung sinasabi ko na parang it easy for the, for the mucus para bumaba o mag-drain doon pababa doon sa baba, doon sa halimbawa sa ang affected ay segmental, tapos bababa siya sa may bronchioles kasi yun yung connect siya doon. Okay naman, bronchioles tapos sa terminal bronchioles. So yung parang pababa, alam mo parang dumudulas kasi maluwag yung daan. So yun. And this will result to sinama ko lang diyan kung focal ba siya or diffuse. Kasi kung yung dilated na bronchi, ibig sabihin focal, isa lang. So, maaaring bronchioles lang, isang bronchial lang, or kaya diffuse, marami, pero sa iba't ibang parte. Ganun. Sa iba't ibang lobe, pwedeng yung left or kaya right lang. Yun. So, pero ito, yung airflow limitation na nasa taas kanina, and this, yung draining po nung exudates dun sa bronchus, this will result to hypoxemia and hypercapnia. Kasi although nagda-dilate po yung bronchi, alin man dun sa division na yon, this will result pa rin po sa may airway obstruction because of the continuous production of sputum. So, nagkakaroon ng hypoxemia and then hypercapnia. So, magpo-proceed muna ako dun sa heart. So, ano nangyayari? So, di ba, kung mapapansin nyo, yung lung disorder, ang complication niya agad is heart kasi magka-connect sila. So, bali ang nangyayari is that kapag po yung pulmonary artery na corresponding po dun sa may alveoli, na-expose po sa hypoxia, ibig sabihin, yung alveoli is maaaring hindi nakaka-receive ng oxygen or enough oxygen, or maaaring may bulley doon o yung parang nangyari sa emphysema kasi parang connected din siya dito na okay naman, nagkatubig, pneumonia, ganun. And then, yung sa emphysema, halimbawa, may bulley, yun yung parang air trapping, nag-enlarge yung spaces doon. Tapos, yung sa loob ng bulley na yun, o parang paltos, is may laman siyang air. Or kaya naman sa iba po is fluid sa skin. So, dahil doon, nagkakaroon ng impaired gas exchange. So, anong nangyayari is that may stimulate nito yung mga pulmonary arteries na mag-constrict. So, pag nagko-constrict, ibig sabihin, sumisikip yung blood vessel, lumiliit. So, that will lead to pulmonary hypertension. Depende pa nga siya kasi the more na maraming nag-constrict ng pulmonary artery, the more na tumataas yung yung pressure dun sa may lungs. So, for example, according to sa nabasa ko, greater than 25 mm per mercury yung pressure, that indicates severe na din daw, severe bronchiectasis. So, 'di ba? So, 'di ba, may this will results to yung constriction ng pulmonary arterioles, may results sa pulmonary hypertension. Ibig sabihin mataas na yung pressure doon. Ano nangyayari is that yung right side ng heart natin, 'di ba, sa heart natin may right atrium, may right ventricle, tapos pulmonary artery, which is yun yung daan o yung blood vessel na papunta sa lungs. So, ang kinikarry ng right side ng heart natin is deoxygenated. So, kung mataas yung pressure doon sa may lungs, ay sa may pulmonary artery o nga doon sa lungs, ang mangyayari, itong right ventricle natin is magpapump siya ng blood at hindi din enough yung ejection ng blood or maaring hindi lahat ng blood is na-eject doon sa may pulmonary artery. Pero ang alam ko kasi may natitira talagang blood dun sa sa heart. In normal po 'yun, parang physiological process ganun. Pero dito nga siguro mas maraming natitira kasi nga mataas yung pressure dun sa may pulmonary kaya hindi na eject lahat. Parang nire-resist na yung ejection ng blood. So kaya kapag bumalik yung 'di ba kunyari nagkaroon na ng gas exchange. So babalik na dun sa may left atrium. So, the oxygenated blood na through pulmonary veins, tapos pupunta sa left ventricle, tapos ipapump na nagkakaroon ng decrease in cardiac output kasi decrease din yung blood na na-eject. And yung pagpump ng right ventricles, so the more na nagpapump siya, the more na gumagamit yung muscle, nag-i-increase ng size, kaya nagkakaroon ng right ventricular hypertrophy o yung tinatawag natin cor pulmonale. So, yun. So, next po, ay, wait lang pala, be. Pataas nga po. Yung hindi ko na isamang isa. Yan. Yung sa may dulo, sa neutrophil elastase. So, yung neutrophil elastase po, kamag-anak siya ng proteinase, which is binibreakdown po yung elastin. So, may mga alpha antitrypsin deficiency. Malaya po na breakdown po ni elastase, yung elastin, na meron po yung elastic fibers natin. So, kapag na-breakdown po, na-destroy po yung elastic fibers natin, ang nangyayari is nagkakaroon ng ineffective lung recoiling. So, ibig sabihin, yung lung recoiling kasi is pinafacilitate niya yung expansion and deflation ng lungs. Kunyari, just imagine yung balloon. Kapag inipan mo yon, di ba may pumasok na air, nalaki siya. Pero kapag halimbawa, pasisingawin mo, ibig sabihin lumalabas yung air, lumiliit na siya. So, parang ganun po yung nangyari sa may, air sacs. And because nga, destroy yung elastic fibers natin, may rin makikibaba po ulit. Tatapusin ko na lang yan. Nagkakaroon ng decreased ventilation. Diba? Dito sa definition ng ventilation, it is the movement of air in and out. So, kung ang nangyayari kasi kapag na-breakdown yung elastin natin kaya nagkaroon ng destruction in the elastic fibers, yung air sacs natin is para siyang hyperinflated. Ibig sabihin may laman na air sa loob kasi hindi siya nailabas. No? So, ganon. And that will result nga sa decreased ventilation kasi hindi na enough yung pumapasok na oxygen because of the obstruction of the airway. Related dun sa increased mucus, production. Tapos, nagkakaroon pa ng, at dahil nga may obstruction, nahihirapan ding ilabas yung air, kaya decrease yung ventilation. So, ang mangyayari is because of this will indicate din na mayroong impaired gas exchange. So, kapag may impaired gas exchange, tapos decrease din yung cardiac output, that will result to decreased perfusion kasi hindi nga enough yung blood yung oxygenated blood na nadidistribute sa body cells. So, first, ang nangyari is nagkakaroon ng inadequate blood supply sa nails kaya nagkakaroon ng nail clubbing plus the clubbing of fingers. Tapos, cyanosis, which is nagkakaroon ng bluish discoloration of the skin because of the hypoxemia. So, yun lang. Next na, be. Tapos na ako, be. Ayan pala. So first is yung question, with bronchiectasis, what substance build ups in the lungs? So yung sagot ay Tapos po, mucus. Tama ba, Gillian? Yes, mucus. Si Gillian gumawa nito, hindi ko na pinalitan. So, bronchiectasis affects which part of the body? Lungs.
Lungs.
Tapos, Next na, be. Bronchi are the airways or breathing tubes in the lungs. Bronchiectasis is an irreversible widening or dilation of portions of the bronchi resulting bronchiectasis. Ano daw po yung common? Sige, ako na lang yung sasagot. Pero hindi ako sure. 18th letter D. Sige, yan yung may ano nito sa question. Sige, go. Next na, be, reporter. Yun pala.
Lang ingay.
Yun? Sige, sorry.
Sige, ako na. Good afternoon, classmates. Ang report ko is, Crypt- cryptogenic organizing pneumonia or COPD, known primarily as bronchiolitis obliterans organizing pneumonia or BOP, is a form of idiopathic diffuse interstitial lung disease. Davidson et al. Coined the term COPD in 1983. This was followed by detailed descriptions of the disease under the term book by Epler et al. In 1985. Cryptogenic organizing pneumonia is believed to be a consequence of alveolar injury and is characterized by the formation of organized buds of granulation tissue obstructing the alveolar lumen and bronchioles resulting in respiratory failure. Organizing pneumonia is a pathologic diagnosis and can be secondary to an identifiable etiology. Cryptogenic organizing pneumonia should be diagnosed only after exclusion of any other possible etiology. Next po, ayan. Etiology, origin, organizing pneumonia, causative agent, idiopathic. Next be. Risk factors predisposing adults in midlife 40 to 60 years of age and other lung diseases. Precipitating lung injuries such as infection, drug toxicity, inhalation of a cocaine, inhalation of toxic gas, gastroesophageal reflux, collagenoses, organ transplant, or radiotherapy. So, perpetuating deprived resources and healthy lifestyle. Next, please. Signs and symptoms of COPD: non-productive cough, dyspnea or shortness of breath, weight loss, fever, and malaise. Diagnostic. Hindi ko makita. Diagnostic. Biomarker ESR and CPR. This is a biomarker for pain treatment. Both blood tests are used to detect inflammation in the body. Radiography, patchy diffuse consolidation mostly involving bilateral lower zones. High resolution computed tomography or CT scan are more detailed than general X-ray, showing detailed images on any part of the body. Pulmonary function testing is a test show how well the lungs are working, measure lung volume, capacity, rates of flow, and gas exchange. Bronchoscopy, flexible bronchoscopy with bronchoalveolar lavage. Bronchoscopy is a test to look at the different parts of the airways in the lungs. Flexible bronchoscopy, a small flexible tube called a bronchoscope, is used. Bronchoalveolar lavage. The saline washes the airway and is then suctioned back through the tube. Lung biopsy is a procedure in which samples of lung tissue are removed to determine if lung disease or cancer is present. Next, please. Medical medical management. Macrolides are cla- macrolides are a class of antibiotic that includes clarithromycin. They are useful in treating respiratory, skin soft tissue, STD, H. pylori, and atypical mycobacterial infection. Inhibit the growth of bacteria. Glucocorticoids, prednisone, that treat allergies, asthma, and many other conditions. Methylprednisolone, it relieves inflammation, also used to treat certain types of cancer. Prednisolone is used to treat a wide range of health problems, including allergies, blood disorders, skin diseases, and infection, certain cancer to prevent organ rejection after a transplant. It helps by reducing inflammation. Stay. Next, please. Nursing management. Nursing management assessment, signs and symptoms, diagnostic findings. Diagnosis, ineffective airway clearance, impaired gas exchange, ineffective breathing pattern, hyperthermia, anxiety. Planning. Improve patient airway clearance, maintain optimal gas exchange, restore breathing pattern, attain body temperature within normal range, demonstrate relaxed manner, resting, sleeping, and engaging in activity. In- Intervention. Teach and assist patient with proper deep breathing exercise, assist patient with bronchoscopy, elevate the head of the bed and change position frequently. Administer oxygen therapy as needed. Provide comfort measures, massage, quiet environment, desired room temperature and lighting. Pharmacologic therapy. Evaluation. The patient's airway clearance is improved by productivity of cough. The patient's gas exchange is maintained to 99% oxygen saturation. Breathing pattern is restored to 18 to 20 breaths per minute. The body temperature of the patient is within normal range of 37 degrees Celsius. The patient shows behavior of relapse, resting, sleeping, and engaged in activity. Pathophysiology. Ayan na, Diyos ko. Ayan, yung pathophysiology. Kanyari, wait lang ba? So, ayan, irritant. Kanya ba lungs? Kung na-irritant yung lungs, tapos, di ba yung bronchi, yung scary air that is breath. Yun yung dyan, yun yung nagkikarry ng air. Tapos, pag siya ay ano po tawag dito? Kunyari, yun na-irritant siya. Tapos, ano pang tawag dito? Tapos, si sensory nerve fiber, hindi ko alam. Thanks. Tapos, ano ba? Di ba si Medalla Oblongata, siya yung responsible sa mga function ng autonomic nervous. Guys, di ko alam. Next na.
Hi guys, rinig po ba ako?
Yes, Bex, rinig.
Okay, thanks. So, pneumothorax. So, yan, partial or total collapse of lung due to air accumulating in the pleural space. So, pag pneumothorax, so may presence of air. Basta pag may presence of air sa pleural space, pneumothorax. Kasi yung presence of air na yun yung nagpo-prohibit sa lung expansion. So, amaya ko na siya mas i-explain. So, yeah, may types of pneumothorax. So, dito sa pneumothorax, before yung tatlo, may naka-classify siya sa open tas sa closed. So, yung open at closed pneumothorax. So, yung spontaneous pneumothorax, closed pneumothorax kasi pag closed pneumothorax, sa loob lang siya, parang nagkaroon lang siya ng problem sa loob. So, yung traumatic, yung tension, it is considered open pneumothorax. So, yung sa simple, yan. Yung simple, it is when air enters in the pleural space. So, ang pinagkaiba lang nilang tatlo, si simple, the air enters. Si traumatic, the air escapes. Si tension, the air is drawn. Sa simple or spontaneous kasi, pwede siyang makonsider na idiopathic. Kasi minsan no cause yung makikita mo dito sa spontaneous. Tapos sa traumatic, dito, yung nagko-collapse yung lung due to trauma, kaya traumatic. Kasi dito yung mga motor vehicle accident, mga gun or knife wound. Tapos si tension, pneumothorax, from complication nung dalawa. So, ayun pala. Yan. So, si spontaneous, yan. Rupture of subpleural or yan. Tapos, minsan, idiopathic siya. So, hindi natin alam bakit bigla siya nagra-rupture. So, si traumatic, ayan, blunt trauma, penetrating chest or abdominal trauma. Tapos, si tension, yan, complication of other types of pneumothorax. So, yung risk factors. So, predisposing is underlying lung disease. So, katulad ni spontaneous kasi, minsan, si spontaneous nagre-result siya sa other illness ng, yan, katulad ng underlying lung disease, katulad ng mga COPD, tuberculosis, or mga cancer, yun, kaya siya predisposing. So, age, gender, tas family history, precipitating accident, trauma, tas perpetrating is smoking. So for the signs and symptoms, mas explain ko na lang din mamaya. So, diuretic chest pain, hypotension, central cyanosis, hypoxemia, tachycardia, respiratory distress, tachypnea, anxious or mediastinal flutter or swing, dyspnea, increased use of the accessory muscle, sucking chest wound, thus expansion of the chest is decreased, and diminish or decreased breath sound of affected side. So, for diagnostic is yung chest x-ray. So, sa chest x-ray, yung pneumothorax kasi, usually nadadiagnose siya through chest x-ray. Pero, usually, in some cases, may CT scan pa para mas provide more detailed images. Minsan, yung ultrasound imaging din, minsan ginagamit din para ma-identify sa yung pneumothorax. So, si chest x-ray, siya yung nagde-reveal ng air or fluid dun sa pleural space. So, dito, yung pneumothorax kasi, na-express siya as a percentage. Sa exam ata natin lumabas yun, yung parang, yung 100%. Ay, namuta ko. Basta yung pneumothorax, ang pwede siya na-express siya as like, kunwari, 100, complete 100, or partial 10% lang ng pneumothorax. So, itong yung mga percentage na to, ito yung parang nag-aalaw ng evaluation dun sa progress dun sa mga x-ray. So, next, yung dito is yung ABG. So, yung ABG, yan, yung sa degree ng, gano'n nakakompromise yung lung function. So, yung altered breathing mechanics, tas yung ability para mag-compensate. So, dito, yung usually kasi yung carbon oxide yung elevated. Tas minsan yung oxygen normal lang or decrease. So, dito natin malalaman si ABG. So, medical management is yung medication is yung antibiotics. So, antibiotics, ang piniprescribe yan para mag-combat ng infection, so, from contamination. So, yan. So, treatment, needle aspiration. So, thoracentesis. So, si thoracentesis, needle aspiration. Procedure siya na, may needle na pinapasok mismo dun sa pleural space, between dun sa lungs, tas sa chest wall. Tapos, itong procedure na to, yung parang nakakaalis ng excess fluid na yung tinatawag na pleural effusion. So, ito yung procedure na ginagawa dun. So, itong pleural space na to, from the pleural space to help you breathe easier. So, chest tube drainage. So, inserted siya between sa ribs mo, tapos yung pleural space. So, itong tube na to, minsan kinoconnect siya sa machine para makatulong doon sa drainage nung mga air or fluid, ganun. Tapos, minsan yung tube nag-i-stay lang dun sa kung saan siya in-insert dun sa between your ribs tas sa pleural space para continuous lang yung alis ng air na para mag-allow lang mag-re-expand ulit yung lungs if ever na-collapse. So, thoracotomy, yan, chest, ito yung inopen na surgically yung chest wall. So, oxygen therapy, yung bibigay ng high concentration ng oxygen para matreat yung isa sa mga yung nakalagay doon sa sign and symptoms na hypoxemia. So for the nursing management is yung assessment, yung sign and symptoms na stated a while ago, tas wound in the chest wall, blunt trauma, penetrating chest, abdominal trauma, tapos sa diagnosis, yan, ineffective breathing pattern, ineffective peripheral tissue perfusion, whisper decreased cardiac output, acute pain, whisper trauma, tas anxiety. So for the planning, relief of pain, mamaya kasi may mababanggit yung pleuritic chest pain ba yan? Tapos, yan. So na-consider sa planning yung, ayan, yung relief of pain. So, establish of a normal effective respiratory pattern as evidence by absence of cyanosis, tas demonstration of increase in perfusion, reduce anxiety. So for the intervention, monitor vital signs, respiration and breath sounds, noting rate and sounds. Tapos, yan. Dito kasi sa monitor respirations and breath sounds kasi isa sa mga sign and symptoms doon yung parang absent breath sounds due to fluid or air. So, yan, we need to monitor it. Tapos, observe for signs of respiratory distress. Assess rise and fall of chest, elevate head of bed, maintain strict aseptic technique, yan, administer medication, provide oxygen therapy if needed. So, evaluation, report pain is reliever controlled, tapos establish of a normal and effective respiratory pattern, demonstrate increased perfusion, appear relaxed, and report that anxiety is reduced to a manageable level. So, next is pathophysiology. Pathophysiology, yan. So, kay pathophysiology, kanina nabanggit si spontaneous pneumothorax is from a rupture of bleb or bulla. So, dahil nga si spontaneous pneumothorax, usually idiopathic siya. So, usually idiopathic or probably from a putik. Then, yan, so spontaneous, from usually results sa other illness ng inlang, katulad kanina binanggit na COPD, tuberculosis, or cancer. So, spontaneous, biglaan. So, that's why idiopathic. So, a spontaneous rupture of bleb or bulla. So, itong bleb or bulla, na-explain na sa kanina ni Jessa, but yung, iano ka lang, is yung bleb or bulla, is yung, parang collection of air or fluid. Tapos, collection of air or fluid. Collection of air lang pala siya. Tapos, between the lung, ita sa outer space of the lung. So, pag nag-rupture si bleb, syempre may mag-escape na air dun sa chest cavity na nagkakos ng pneumothorax dahil may nag-escape na ng air. So, here is pleuritic chest pain. So, dahil nga, may air na dun sa chest, sa chest cavity. So, pwede siya mag-result sa pleuritic chest pain. So, si pleuritic chest pain is characterized by sudden and intense, sharp, stabbing or burning pain sa chest. pag nag-inhale or exhale. So, usually na-exacerbate siya pag deep breathing, pag naubo ka, pag nag-i-sneeze ka, tapos minsan natawa. Yan. So, yan. Tas dyspnea. So, dahil nga may nag-rupture na breath at nag-escape yung air na yon, ayan, nagre-result siya allowing air from the airways to enter the pleural cavity. So, yan, nagre-result siya sa increased intrapleural pressure. So, mamaya ako na yan, anuhin. Dito muna ako para sabay-sabay. So, spontaneous nga pala, it is closed pneumothorax. So, ito, si traumatic pneumothorax is open. Kasi, yan, open. Due to trauma. So, traumatic pneumothorax, ayan, may penetrating or blunt mechanism cause a hole in the parietal pleura. So, yung hole na tinutukoy niya is either gunshot or yung mga stabbing wound, yun. Anything that causes na magkaroon ng opened na, yun, yung hole dun sa may natin. Dahil nga may hole, nagproproduce siya ng sucking sound. So, yung sucking sound na yun, dahil nga, di ba, yung air na nasa loob ng lungs natin is negative pressure. So, nagkikreate siya na parang vacuum effect, namihigop siya. Tapos, kaya siya nag-sucking sound kasi nga, produce a sucking sound kasi yung air parang, ayun, sucking sound, parang, dahil nga may butas doon, na usually dapat lang doon daanan sa may trachea dito, parang instead, ulit. So, produce sucking sound. So, dahil nga may nakukuha na siyang air from outside, yun yung nagke-create ng sucking sounds na yun. Tapos, dahil nga may hole na siya, yun yung nag-aalaw ng air para may pumasok dun from the outside to pleural cavity na nag-i-increase din ng intrapleural pressure. So, instead na negative pressure lang yung nasa loob ng lungs natin, instead na negative pressure lang, nagkakaroon na rin siya ng positive pressure. Rarely may atmospheric pressure din, pero mostly, ang dumadagdag dito sa pressure na to is yung positive. Kasi dapat negative lang siya. So, eto, may singit kasi dito galing sa baba. Ano ko na rin para sabay-sabay sa increased intrapleural pressure. So, ayan, si tension pneumothorax. So, si tension pneumothorax, ano siya, from na complication dun sa dalawa. So, complication dun sa traumatic, tapos dun sa spontaneous. So, si tension pneumothorax, yan, may disruption of parietal or visceral pleura. So, dito, ang pinagkaiba lang ni tension pneumothorax dun sa iba is natatrap yung air sa loob. So, the air can enter the pleural space but cannot leave. So, kung may positive pressure ka na parang inhale lang siya ng inhale, parang nasa loob lang siya, hindi siya malabas. So, dahil nga na-trap siya, si tension, increase yung intrapleural pressure niya. So, pag nag-i-increase yung intrapleural pressure, ano siya sa lung collapse. So, itong lung collapse na to is yung ito muna, yung absent breath sound. Katulad nung kanina na binanggit ko is yung absent breath sound kasi nga may air of fluid or fluid around the lungs. So, kaya siya, absent or decreased sound. Tapos, ito, increased use of accessory muscle dahil nga may lung collapse. So, pwede rin itong sign of abnormal or labored breathing pattern. Tapos, yan, ito, decreased expansion of chest wall. So, si intrapleural pressure, gumora siya dito. So, yan. si mediastinal flutter or swing. So, si mediastinal flutter, ano siya, siguro yung iba familiar na. Si mediastinal flutter kasi, ito yung pinupush yung buong mediastinum sa affected side dun sa lungs. So, basta pag mediastinal flutter, parang push sa affected side. Yung buong mediastinum, like yung may mga heart, yung thymus glands, yung yan, portion of the esophagus, sa trachea. Tapos, ito si mediastinal, si swing. Pero yung mga nababasa ko sa book is yung shift or swing. So, ito naman, is baliktad sila. Ito naman, nagpupush si mediastinum sa unaffected side. Push sa unaffected side. So, for example, kaya di ko na din siya ginawa ng bago kasi parang pwede siya kay, especially kay open pneumothorax, kay traumatic. So, katulad nung yung kanina, pag nag-i-inhale ka, may atmospheric air or may positive pressure kang nasasak dun sa pleural space, katulad nung kaninang nasabi. Tapos, dahil nga doon, di ba, nag-increase yung intrapleural pressure na nag-result sa collapse ng lung sa affected side. So, nagpo-push siya sa unaffected side kasi nagde-decrease yung volume of air niya sa unaffected side. Kaya siya namumove doon. So, pag expiration naman, yung air nag-escape doon sa katulad kay traumatic, yung wound, nag-escape si air doon. Nagde-decrease yung positive pressure doon sa affected side. Kaya yung buong mediastinal contents nag-i-swing back. So, yun yung mediastinal flutter. So, yung kay swing naman, or yung kay shift, is yung katulad nung kay tension pneumothorax. Yung, kunwari may tear sa lungs fracture, di ba, nagkakaroon ng air yung pleural space. Nag-i-increase yung positive pressure, tapos, nagbibuild siya sa pleural space, tapos yung affected na lang, nagko-collapse, tapos yung buong mediastinum, nag-shift naman siya sa unaffected side. Di ba, baliktad lang yung nangyayari sa kanila. Pero, pares yung buong mediastinum na move. Kaya, dahil namumove yun, dahil parang nag-i-swing back and forth lang siya kada mag-i-inhale at exhale siya, pwede siya mag-produce ng serious circulatory problems, katulad ng hypotension, ng tachycardia. Tapos, dito, tracheal deviated. So, pag spontaneous pneumothorax kasi, yung trachea natin, namumove siya, siguro due to the pressure dun due to the pressure. So, sa spontaneous, yung pag-move ni trachea, nag-move siya towards sa affected side na lang. Tapos, or minsan, hindi siya nag-shift. Pag tension, papunta naman siya sa away from the affected side. So, pag tracheal deviated, pag spontaneous towards the affected side. Pag tension, kay tracheal deviated, away from the affected side. Dahil nga naapektuhan si trachea, it could result to hypoxemia, tapos yan yung cyanosis, tapos respiratory distress. Kasi nga, parang ang tawag doon, parang na ano yung way ng hangin mo. Ganun. Yun lang. Oh my God. So, board exam question. So, yan. Sahin ko ba? So, number 1 is yan. Obese adult who smoke 3 packs of cigarettes daily is admitted for major abdominal surgery. Post-operatively, the most appropriate laboratory value that the nurse should monitor routinely that would reflect the client's respiratory status is the Jessa, anong sagot?
Be, may sagot pala sa PPT.
Ay, meron.
Wait lang, tingnan ko
Hindi ko alam sino gumawa nung
Oo, ngayon ko lang.
to eh. Kasi wala siyang name. So, ayun. Ano, skip na lang tayo.
Where are you?
Saan ko ito mga alam?
Ba't wala? Baka sila walang name.
Next
Saan
na.
kasi sige name
Next na.
ang sagot sa number 1 ay single.
Ano? Or next time na lang, hiyaman na lang.
Wala palang sagot.
Wala? Next na yan.
Wala pala.
Go, Leia. Go na next. Thanks. Ano ba pala?
Good morning, class. Afternoon. Good evening, class. Ay, sorry.
Ay, may nasagot.
Kala ko
May
ako
nasagot. Hindi ba, ikaw na nga, date lang ata. Wag ng
Ako na? Rinig po ba ako?
Yes, go. Yes, be.
Okay. Okay, let's start. So yung last nating disease for today is pulmonary embolism. So, yung pulmonary embolism po kasi, ito po yung, next po. Next po. Okay. So, yung pulmonary embolism, ito yung disease siya na nagkaka-clots dun sa arteries or veins ng lungs natin. And dahil nagkaka-clots, so nahihirapan tayong huminga, yung blood flow hindi as effective and bumababa yung oxygen levels sa body natin. So imagine mo, isang clot pa lang, ang hirap na. So imagine nyo pag ang daming clots doon sa may lungs natin. Next po. So yung term ng embolism is credited to Virchow in 1872. Trendelenburg, a noted German surgeon and founder of the German Surgical Society, realized that sudden mortality associated with this condition while reviewing the deaths of 9 patients from pulmonary embolism at the hospital in Leipzig. So next, please. The causative agent niya is blood clots, or in other words, emboli. Emboli. Next, please. So, ayan. Yung risk factors, yung predisposing, meron tayong factor 5 Leiden, prothrombin gene mutation, deficiency of protein C, protein S, and antithrombin. So, yung precipitating, meron tayong cancer, surgery, trauma, or fracture. Ganon. Immobilization, pregnancy, and the postpartum period, long-distance travel, hospitalization, catheterization, and acute infection. Tapos, yung perpetuating, poor response of medication to derived resource and immobility or lack of physical activity. Next po. So, signs and symptoms natin, dyspnea, and of course, chest pain, coughing with blood, rapid or irregular heartbeat, lightheadedness or dizziness, leg pain or swelling or both.
and redness. So, explain ko naman yun mamaya sa pathophysiology kung ba't nagkakaganyan. And then, next po, yung diagnostics natin or yung tests or like tests we have to undergo para ma-confirm if we really have pulmonary embolism. So, meron tayong pulmonary angiogram, D-dimer test, meron tayong CTPA or computerized tomography pulmonary angiography, isotope lung scanning, and lung vein ultrasound. Next, please. Since blood clot nga siya, of course, kailangan nating medication is yung kokontra. So, we have blood thinners or anticoagulants. So, like warfarin, heparin, ganun. And merong treatment, compression stockings or thrombolytic therapy. Next, please. So, assessment. Okay, so signs and symptoms, tapos yung diagnostics test. So, diagnosis natin, ineffective peripheral tissue perfusion related to obstructed pulmonary artery. So, yung next naman is risk for shock related to increased workload of the right ventricle. Tapos, acute pain related to pleuritic origin. Next. So, syempre, yung planning natin, increased tissue perfusion, verbalized understanding of condition, therapy regimen, and medication side effects, display hemodynamic stability, report pain is relieved or controlled, and follow prescribed pharmacologic regimen. Next po. So, intervention, prevent venous stasis or decrease of blood flow. Monitor thrombolytic therapy, manage pain, manage oxygen therapy, and relieve anxiety. Next po. Evaluation. So, increased perfusion. Tapos, nag-verbalize na ng patient yung condition niya. Tapos, nag-display ng hemodynamic stability. Tapos, yung pain niya, either relieved siya or na-control. And, sinusundan naman ng patient yung prescribed pharmacologic regimen. So, dito na tayo sa patho, classmates. Hindi ako sure, pero try ko. So, sa pathophysiology ng pulmonary embolism, start tayo sa Virchow's triad. So, meron tayong triad. So, meron tayong 3 factors na we take into consideration, which is the slowed blood flow or stasis, hypercoagulation, or yung pagdami ng clotting factors dun sa site kung saan basta yun. And then, damage to blood vessels. So, dun muna sa baba, classmate, like extrinsic pathway and intrinsic pathway. So, dito we're gonna talk about paano nag-i-inflame, ganun. So, extrinsic pathway, yun yung external trauma. And yung intrinsic pathway, yun yung trauma from the inside. So, marami namang factors na pwedeng mag-reason kung bakit yung veins. So, pwedeng reason niya, extrinsic or intrinsic, ganun. Tapos, magre-release siya ng prothrombin, thrombin, tapos yung thrombin magre-release ng fibrinogen, tapos fibrin, thrombus. And di ba nga, nung inaral natin to sa anatomy nung first year tayo, ito yung reason bakit nagkaka-redness at saka inflammation and pain. So, yun. So, may idea na tayo kung ba't nagkaka-redness. And then, so start na tayo dun sa sa taas, yung pa-horizontal. So, sa Virchow's triad, nagkaka-DVT or deep vein thrombus. So, like, thrombus, like blood clot. And tapos, di ba nga, like kanina, yung causative agent ng pulmonary embolism is emboli. Yung emboli, yun yung tinatawag nila dun sa blood clot mismo, yung nagbablock dun sa veins natin. And femoral vein. So, yung na-research ko kasi kanina, usually ang DVT, nag-occur siya sa low extremities natin, usually below the knees. Doon siya madalas nangyayari. And then, yung oxygen sa body natin, bumabalik yun sa heart through veins and tissues, ganun. Ganun siya bumabalik sa ating heart. So once na bumalik siya sa ating heart, alam naman natin yung parang process kung paano siya pumunta sa lungs, ganun. Or like paano siya nagsisirculate sa heart. So sa right atrium, then sa right ventricle, then sa pulmonary trunk. Pwede pa-next muna kasi yung tuloy niya nasa next slide. And then, ayun, once na nasa lungs na yung oxygenated blood, dahil nga meron tayong blockage dun sa isa sa mga arteries natin, mag-i-increase ng ventilation pero decrease ng perfusion dahil nga may blockage eh. Kasi right, yung perfusion is the passage of blood. And then, wait lang. Dahil doon, nahihirapan yung lungs natin dahil kasi nga oxygenated blood and ang onti nung pumapasok doon. So, parang naghahanap yung lungs natin ng oxygen. Tapos, pwede pataas ulit. Ay, pan-next. Ayun. So, like, once na nangyari lahat yun, nagka-inflammation, so mayroon tayong increase in pulmonary vascular pressure. And then, dahil doon, nagkaka-increase tayo ng right ventricle pressure. And ayun, chest pain. Chest pain, makakaramdam tayo ng chest pain. And if hindi na-control yung chest pain na yun, and since magpo-force yung body natin na mag-work harder para masupplyan ng oxygen yung lungs natin, and dahil nga may blockage, pwedeng mag-rupture yung artery natin. Kasi nga, nahihirapan, tapos may blockage pa. And once na nag-rupture yung artery natin, dun na yung parang magka-cough tayo ng blood. Hemoptysis. Ayun. Magka-cough tayo ng blood. Kasi nga, sira na yung natin. Like, yung sa lungs. Tapos, pababa po ulit. Ayun, dahil nga nag-rupture na, tas overwork na yung right ventricle natin, so magkaka-heart failure na tayo sa right side ng heart natin, which will lead to decreased stroke volume, decreased cardiac output, tas decreased BP. Like, sobrang overwork niya trying to provide, and like, it's like just giving up na kasi hindi talaga kaya dahil nga dun sa clot na yun. And then, dahil nasa right ventricle, hindi na siya makaabot sa sa right side ng heart natin, hindi na siya makaabot sa left side ng heart natin. So, yung cardiac output natin, of course, di-decrease din doon. And sympathetic response, of course, i-increase ang heart rate natin, tachycardia. Kasi nga, like I said, it's trying to provide oxygen para sa lungs natin. Pero nahihirapan talaga siya. Kasi yun. Okay, yung dito sa gitna, yung sa may parang lightheadedness, dizziness. Yung sa taas lang na cytokines, di ba? So yung increase in cytokines, yung cytokines kasi, siya, like, wait lang. Proteins yung cytokines na nag-a-act as regulators. And like, ano ba yung nakakonect sa cytokines? Yung inflammation, di ba? And nag-hyperventilate tayo. And since nag-hyperventilate tayo, meron tayong, wait lang po, hypnocapnia. Hypocapnia. And then, yung hypocapnia is state of reduced carbon dioxide in the body. So, di ba, ayun, nag-hyperventilate tayo. So, since mabilis yung breathing natin, hindi parang nafe-feel talaga yung lungs natin. And alam naman natin pag like, nagkukulang tayo ng either carbon dioxide or oxygen sa body, like, mahihirapan tayo and like, ayun, shortness of breath, na magkakadyspnea tayo. And like, if hindi maka-reach yung oxygen sa brain natin, of course, lightheadedness or dizzy tayo. Ganun. Ayun. Next po. Okay. So, sinong gusto sumagot, classmates? What is the most common presenting symptoms in pulmonary embolism? Tatawag ba or ano lang?
Ikaw, Beth.
Okay. Sige. Noemi. Number 1 po. Wait lang. What is the most common presenting symptoms in PE? In pulmonary embolism? Ay, shit.
Naka-highlight, naka-bold yung sagot.
Naka-bold. Bakit sa akin walang bold?
Boy.
One pa lang.
Ay, naka-bold na.
Hindi nga, letter B. Tapos number 2, ewan ko lang, baka lahat yun yung sagot.
Tapos number 3, Geneva score.
Yeah, yun lang yung nakalagay eh. Walang choice, walang added.
Ayun, thank you classmates. Tapos na po kami.
Alis na tayong lahat. Ganun. Tapos na ba?
Yes.
Gege.
Thank you for listening classmates.
Thank you.
Tama, naka-bold.
Out na? Ata. Out na. Thank you. Bye-bye.